The latest prematurity report card from the March of Dimes gave Louisiana an F. Last year, 12.3% of babies born premature in our state. So this morning, we're bringing some awareness. Right now, we have Dr. Paul DuTreil with us to explain how folks can help keep our babies healthy and born when they should be born. Good morning, and thanks for coming on.
Thank you for having me.
So let's talk a little bit about prematurity. I think there are some kind of misconceptions about it. What are we talking about exactly here with premature babies?
So premature babies, when we're talking about a preterm birth, we're talking about those babies that are born before 37 weeks of gestational age. Traditionally, we define a full pregnancy at 40 weeks. So just 3 weeks prior to that expected due date is considered preterm.
Okay. And for folks who are having twins or something like that, that's pushed up a little bit.
A little bit, and those patients still are more at risk for a preterm delivery, correct?
Yeah, so Louisiana, year after year, we have just awful results when it comes to this. It is Prematurity Awareness Month, so we're going to talk about some of the things that women can do to change that and buck that trend a little bit. What are some of the tips that you have, some of the advice for moms?
You know, there are certain risk factors, so pre-existing medical conditions, infections, lifestyle choices, things like smoking, drug use, alcohol use, things that we can actually work on. So that would be the first place to start, is really with those factors, looking at those lifestyle changes that you can make. Establishing care with a doctor early on. So when you find out that you're pregnant, get into a physician, see somebody so you can talk about those risk factors, and then also talk about potential treatment options that could reduce the risk for a preterm birth. Obviously, keeping a healthy diet, exercising, maintaining a good weight, both before pregnancy and during a pregnancy are helpful. Avoiding infections, and then making sure, again, that you're kind of leading a healthy lifestyle. The interesting thing is that if you avoid getting pregnant within 18 months of a prior delivery, you actually can reduce that risk as well.
Yeah, that was something that I actually just learned recently and didn't know. You really want to do wait and give some time kind of between your babies.
Correct.
Okay, well, some really easy tips. Like you said, something that you focused on there was going in to get care, see a doctor. You have to do that. A lot of these things are very simple steps you can take, but these moms-to-be don't necessarily know these things.
Right.
So it's good to just check in with an OB/GYN and make sure that you're getting the care you need. Dr. DuTreil, thanks so much for coming on. We
Thank you for having me.
appreciate it.
Absolutely.
And if you want any more information, we have it online on WGNO.com.